Yeah, I think there's been really a lot of great research presented here at the EAN within dementia, so I'm really happy to be presenting the highlights tomorrow. I've been especially interested and happy to see that there has been a lot of research going into looking at management needs that we can address in patients with dementia now that we still don't have a disease-modifying therapy. So there has been a nice study on the impact of sleep disorders following stroke in relation to cognitive impairment, and showing that treatment of these may benefit patients in terms of cognitive function. And that's one thing that we need to be aware of in patients, not only with vascular dementia, but also other dementia disorders, that if they have sleep disorders, we need to identify them and treat them. And the same goes for a Swedish study which investigated the impact of hip fractures in patients with dementia. And here it was clear to see that there was an increased mortality in patients with dementia who had a hip fracture. They were longer in the hospital. There was a higher chance of readmittance. So that's another example of how we need to be aware of patients with dementia as a vulnerable group of patients, and a group of patients where we can actually do something to improve the care, to improve their quality of life, and possibly also slow down the progression of the dementia. There's also been a couple of nice presentations on blood-based biomarkers, a study on phosphorylated tau 181 in plasma in a large cohort of patients with Alzheimer's disease who also underwent amyloid PET scanning. And here it was the authors demonstrated a very nice diagnostic accuracy for this plasma biomarker for predicting amyloid positivity. And this really goes to show that, and there's also other data to corroborate this, that you sort of get a dual diagnostic value of measuring phosphorylated tau in plasma. You get information about the tau status of the patient, but also indirectly knowledge about their amyloid status. So I think that was really exciting and promising to see.